This is a special issue from In the Line of Duty. Hello, I'm Ron Barber. You're about to view our interview with Dr. Andrew Dennis, a nationally prominent trauma surgeon who also happens to be a full-time cop. I am confident you will learn some vitally important things about police, policing, pandemics, officer response, training, and safety during these challenging times. But first and briefly, it is obvious online training is playing an ever more important role in police and first responder continuing education.
Training is the main thing. I mean, even the highly trained people get shot, but we need to train, stay focused.
Please consider visiting us at lineofduty.com, where you can access the only reality-based online video training for law enforcement. Just click here to get a free trial. And for 2 weeks, the training is on us at no cost, no obligation, no credit card. You only want the best for your troops when you buy firearms, vests, handcuffs, personal protective equipment. Shouldn't that also hold true for online training and education? Thank you. And now, Line of Duty's interview with Dr. Andrew Dennis.
I'm a trauma surgeon by training. I am the division chair of emergency and pre-hospital traumatology at the Cook County Trauma Unit, which is the oldest trauma center in the nation and one of the busiest urban trauma centers in the world. I'm also a police officer. I've been a police officer in Illinois since 2002. I've been attached to the Northern Illinois Police Alarm System Emergency Services Team, which is a multi-regional SWAT team, since 2002. And I've been part of several different agencies in Illinois, most recently the Cook County Sheriff's Police up until 2 years ago, and I just recently joined the Illinois State Police as the Chief Surgeon, Medical Director, and as a sworn member of the agency.
Doctor, you recommended Illinois troopers lose the old Smokey Bear hats and their ties. Why?
I don't think our troopers have ever gone without hats and ties historically. Maybe once, I think, potentially. So with regards to the hats and the ties, if you look at what parts of your uniform that you don't wash, think about it, they would be your hats and your ties. There's also some loose data, and it's not great data in the medicine world, but it's been discussed and it's been argued over the last 2 decades whether doctors should even wear ties and whether ties become carriers of infection for physicians when they go room to room. There's no data on this in law enforcement, and even the data in the medical world is highly debated. That said, if you're going to take the most conservative route, then look at the parts of the uniform that you are not washing and lose them. And that's what we did. It was not a hard recommendation to the director, but it was something we should think about, and the ISP leadership decided to move in the direction of being very conservative. So that's why we went without.
What other recommendations did you have for Illinois troopers?
So imagine this, right? A law enforcement job can go from sitting in your car and being reactive to being very proactive, which is the normal stance of law enforcement, to being a medical first responder in a heartbeat, and to being in a fight in a second. So if you had to design a personal protective recommendation for an individual who lives in all of those worlds at any given second, that's the guidance I went with. There were no CDC guidelines at that time that were really adequate for law enforcement, given the fact that they could be jumping into any one of those worlds at any given time. So what's the riskiest world that they're going to jump into? It's either going to be toe-to-toe fighting with somebody face-to-face, or it's going to be an emergency medicine rescue, such as CPR, which is the most dangerous thing a healthcare worker can embark on, because that's where virus is aerosolized during CPR and especially during airway maneuvers. So I took the position very early on to equate our troopers and Illinois law enforcement to healthcare workers. So I massaged the healthcare worker guidelines, which were out, and I said, all right, well, let's use these. We'll adjust them as necessary, as per availability and per what is really feasible for a cop to do and be able to work with. And that's how we're going to build our guidelines. So that's what we did. So the early guidelines were recommending an N95 because I knew we had them. Now, the question is, do you really need an N95 mask? Probably not most of the time, because majority of the time you just need face protection from droplets, given the circumstance around this virus. However, if you're fighting with somebody or you're doing CPR, it's no longer droplet, it's aerosolized. That's where the N95 comes in. So if I had to work for the lowest common denominator of where we could all fit into, and knowing that majority of us have N95s or will have access to N95s, at least in Illinois, that was the recommendation, is to go with the aerosolizing mask. Also, we went very early for eye protection because you can inoculate yourself with through the eyes, through any mucosal membranes. So eyes and mouth and nose are obviously the most critical places that you can self-inoculate. And the virus lives in the back of the nose, in the upper parts of the throat. So given that, we very quickly sought goggles for as many of the troops as we could. And then we were able to get a line on ordering full face shields for the troopers. So the first early recommendations that we put out were face shields and N95 masks and gloves for any potential physical or close contact encounter. We've since broadened that to take away the discretion in a way and say the moment you get out of your car, we have just moved as of the last 24 hours to a universal masking policy, which is when you get out of your car, you should be in PPE at that point in time because you just don't know where the situation is going to go. We also, as of tomorrow, this goes into effect for the state police, we're moving towards universal masking for administrative circumstances as well. So our employees that are essential employees that need to be at work will still be in a mask all the time. And we're handing out surgical masks or procedural masks because those are the individuals that really just require droplet precautions. And then the other early thing that we did with the PPE, obviously, was we made very, very clear recommendations on social distancing, both at work and at home, but also, employee to employee. We made sure we made that distinction, so cop to cop, and hand washing, and we started sourcing and making sure that our areas were washed down, and that we distance people at all costs, including the communication centers, including roll calls. Now, granted, that state police, we don't do roll calls, but smaller agencies do, and there's been a lot of most agencies have taken the guidance and either moved roll call to a virtual platform or separating the roll calls throughout the agency or throughout the building into two rooms, and most importantly, distancing the individuals and wiping down the areas before and after.
Andrew, there have been articles about people hockering, spitting, or coughing on law enforcement officers. What are your recommendations under those circumstances? How should they respond? What should they do?
Well, first and foremost is prevention, right? I mean, all of this is based around prevention as best as you can. So any encounter with the public, you should be in protective equipment. So you should have a mask on. You should have eye protection. And when I talk about eye protection, just to be really clear, I'm not talking about glasses and I'm not talking about shooting glasses because those allow gaps around the eyes and they do not protect you from droplets. A little protection is better than nothing, obviously, but that's not the recommended. The recommended is some sort of face shield that covers your entire face or wraparound goggles that make contact with your face. Now, I get it. Most people are not going to have those. So I will accept something better than nothing. So shooting glasses are certainly a suboptimal but acceptable alternative until you can get the right PPE. With regards to fighting with people that want to do you harm, that say that they are positive or they're going to try to cough on you, The more protection you have, the better. Granted, if you're fighting with them, you may not have that option. But that's where we started now triggering those individuals as likely exposures. The other thing that we offer, that we put in with all our troops, is procedural surgical masks. So, like the surgery masks that go around the back of the ears. If you take someone into custody, that mask goes on them. If you do a citizen assist and you offer someone a ride in your car, that mask goes on them. So no close quarters without the other individual having a mask. We're not giving our N95 masks out, but we're putting the disposable, cheap, relatively more available procedural masks into the hands of the troops, saying you must put these on your prisoners and you must put these on anyone that gets in your car or you're in close contact with for a period of time.
Andrew, what are your thoughts if a cop in a busy precinct or district has half a dozen or more close physical encounters during a given shift?
There's no panacea answer for that question. It really comes down to the individual. You have got to keep a distance as much as possible. If you can't, then you need to have protection on, eye and aerosolized protection. At the very least, droplet protection. And anyone around you, if you're going to violate the 6-foot social distance rules, then you must make every possible effort to put both groups into masks. That's the best recommendation I can probably give you, with the understanding that we are all in different circumstances, and that all these circumstances are fluid and highly dynamic.
How do you envision the coronavirus pandemic changing officers' lives going forward?
That's a really good question. So as a surgeon, as a cop, more importantly as a cop, and here I'll give you a little backstory. A lot of physicians recognize that they put themselves at risk on a daily basis, but if you're a pathologist or an obstetrician, that's not really the job you signed up for, right? So, my wife's an obstetrician, she goes to work, and she signed up as a job to help individuals and help people. But it wasn't necessarily that she reconciled long ago, like most police officers should have, that they may not come home at the end of the day. That was not part of her psyche in her job. In law enforcement, I think we're a little ahead of the curve there, because we have reconciled that. If you haven't, you should have. That if you leave the house, you may not come home. And that's part of the associated risk. Obviously, we don't want that to happen. And it's the improbable option, but it does exist. And that's part of our psyche. What most of us did not, even as police officers, address in that reconciling of I may not come home or my life is at risk, is putting our families' lives at risk. So I think the biggest elephant in the room that we as law enforcement need to work around and have a discussion with our family is that we are putting our families at risk, and we need to find ways to mitigate that as much as possible, because the moment you have an encounter with someone that is positive or possibly positive, you run the risk of bringing that virus into your home and to your family and your children and your wife, etc., or partner. So what I'm saying is that the measures that we take on the street move into our homes, and we need to take those seriously. I get home every day, I disrobe in the garage, I leave clothes there. I bag my clothes that were at work, and I take them right up to the laundry room, throw them directly in the laundry, and wash them times 0. My shoes stay out in the garage. I wash my hands the moment I walk in the house. I wash my hands the moment I walk in my car. I wipe down my car before and after I get in it. But creating a routine to sanitize your house and proof your house based on the fact that you're coming back from an open environment is absolutely critical. And it may not solve your problem totally as far as reducing risk to your family, because you could be shedding virus if you've been exposed before you're symptomatic. But it's a start. The other thing is that we all should be socially distancing ourselves from our families. And that's really hard. So social distancing, at the very least 6 feet. Do you need a mask? Probably not. If you want to wear one, it will not hurt you. But making sure you're washing surfaces down, washing your hands, and keeping distance from your family. I haven't hugged my kids since this started. and I hope most people haven't, because it's painful, but it's a fact that we kind of have to work with right now. I haven't hugged my wife or kissed my wife since this started, and I encourage all of our law enforcement family really to do the same. It's not something you can just kind of get out of your car, walk in your house, and say, "I'm good, I'm back." It doesn't work that way. You've got to actually take steps to mitigate bringing this home.
How much of this is going to spill over into a post-coronavirus world, Doctor?
I think we are in a new world. I think, hopefully this will be mitigated at some point with a vaccine. That's my prayer, right? Any of the medical measures that we have right now are really unknown, but the world is forever changed. What I think we've proven is that we don't need to be personally at a lot of meetings. I think we've modified our hygiene, because the next pandemic is just around the corner. So, and it's not like we haven't been here before. We were here with SARS. We were here with bird flu. We were here with other viruses, just not to this degree. So, from what I've taken away is, man, the virtual world has grown, and it's fantastic, and it has options, and I don't need to be face to face next to somebody at every meeting. And then I think the universal precautions that we take are real, and I think that we have got to learn to be more ready. Let's say, put it that way. I think at this point in time, we should never be caught behind the 8 ball like we were with our surplus of protective equipment for law enforcement and public safety around.
Many cops have been given the responsibility of administering naloxone to opioid ODs and drug ODs. And a lot of these officers never felt they should have been tasked with that responsibility in the first place. What's your take?
Another great question. The biggest thing you have to remember about Narcan is you're going to take someone who is non-combative and with a very high degree of certainty make them potentially combative. So you have to measure that. In my feeling about Narcan and the way we've pushed this forward to the troops that I have influence on is that if they're breathing, don't give it. If they are not breathing, we give it. And I think that's really the black and white recommendation for it, because if they're breathing, you got time. If they're not, you don't have time. But the risk of them, the moment you give it, the risk of them coming up into the world very combative, and now the fight's on, that's real. I mean, the biggest struggles, honestly, we've had from the law enforcement side is continuing training, modifying our training. For example, modifying our firearms and our range time. We didn't eliminate range training. We did eliminate control and arrest tactics, hand-to-hand, physical contact training for the most part. We're graduating a class of our academy early because of this, because it's a residential academy, and I don't think it's a safe place to put all those people. We could have an epidemic within the agency. So we disbanded the residential living, and we moved our training out to the field when this all happened. And we've continued a lot of our training, but we've modified it significantly into masks and mandating distances.
Will this continue post-coronavirus?
No, I think we will get back to a norm, but it will certainly be a modified norm. I mean, police officers need to learn how to fight. They need to learn how to control and arrest, and those things you cannot sacrifice. Will we be in masks for a while? Yeah. I think there's going to be a transition time between after the peak and before a vaccine. So during that time, I think we're going to have to continue modifications.
What seems to be on the minds of most of the officers with whom you have spoken?
All the above. Early on, we created a document called Working With and Around COVID-19 for the agencies and for statewide law enforcement. And that was very simple. The biggest questions we tried to address in that, which was the what happens if I get sick at work, what do I do? You go home. Period. The end. Your supervisors are to send you home. There's no, put that person on desk duty. No. If you are showing signs of cough, fever, you just don't feel well, I don't care. It doesn't matter. You are to leave the workplace. It's a zero tolerance thing at this point. You need to notify the supervisor, and you need to wash your area down. Zero tolerance. The other questions that are coming up is, when can I go back to work? The CDC has two guidelines, two recommendations out. One is a symptom-based strategy and one is a testing-based strategy. So we put our individuals, and the recommendation is to put individuals into one of those two strategies. Now, granted, they were designed for healthcare, but we adopted them for law enforcement. The other really common question is, I had an exposure, should I get tested? The answer is no, because if you're not symptomatic, the probability of you having a false negative test is very high. So it's a false sense of security, and it doesn't help us. Now, if you test and you're positive, great, that solves a problem. But you probably didn't get it from that exposure. You had it before, because the average time that people are showing symptoms is about 6 days. So when to work, when not to work, when can I come back to work, and what happens if I get sick at work? Those are the biggest questions that were being asked.
Andrew, what do you feel officers absolutely need to have in their cruisers from this day forward as far as PPE, sanitizers, etc.?
So the mandatory requirement is an N95 or a surgical mask that you are wearing all the time when you're out of your car. Sanitizing wipes to clean your car before and after you're in it, and you put anyone else in it. Hand sanitizer that you use frequently, because a sink and soap and water, although that's the first recommendation, is not obviously available when you're on the street. And gloves and eye protection. You know, the CDC recommends a gown for if you're going to do CPR or something like that. We recognize that that's not really functional for law enforcement. But if you do CPR, yeah, you should have something that you can put over either the person's face, the patient's face, or your person, in addition to an aerosolizing mask. So if you're going to do CPR, you must have an aerosolizing mask on and eye protection. Otherwise, you shouldn't be doing CPR, because CPR is the most dangerous thing that healthcare providers, and cops can be healthcare providers transiently, that you will ever encounter, because that's where you're putting the virus into the air and it can linger for an hour or so. And that's where your greatest point of exposure is going to be.
What are your thoughts regarding first responders who will almost certainly be experiencing PTSD or severe emotional trauma as a result of this?
Yeah, I'm really glad you asked that question, because that is the elephant in the room, and it's something we're also very aggressive about addressing. In our agency, we have a whole department dedicated to resilience training and offering support. I mean, it is an employee assistance program in a way, but we also have a network of psychologists and psychiatrists friendly to law enforcement that we've put out a list that are actively taking patients, and these are vetted individuals statewide. It is the elephant in the room. There is a significant degree of anxiety, underlying baseline anxiety that we've never seen before. Not just from cops, paramedics, nurses, doctors, everybody. Again, a lot of it comes back to fear, and specifically fear, not for yourself so much for the cops, although that is clearly part of it. It's fear for your family. Because again, that's the one thing we all have never really reconciled so well in our day-to-day walking out of the door. And then there's our baseline anxiety and post-traumatic stress injury that goes along with loss and day-to-day and seeing loss, whether it's friends, colleagues, or patients. So, you know, there's a baseline fundamental post-traumatic stress that goes along with our jobs. And then that can be elevated to a post-traumatic stress injury. I'm not really a fan of using the word post-traumatic stress disorder, because, you know, we treat injuries, we cope with disorders more commonly. And these are acute injuries. In the world of trauma surgery, it is something we've changed. It's the biggest paradigm shift in the last 5 or 6 years, is treating not just the physical injury, but the stress injury simultaneously. And that's the same thing for law enforcement and public safety. So yeah, it's something we need to address. You've got to seek resources, and to answer your first question is, what should you do? If you're feeling it, seek help. There are lots of resources for mindfulness and resilience training that can keep you ahead of the game, because we want to stay left of bang on this as opposed to being reactive and right of bang. So tools for resiliency is where I would start if you're okay. If you're not okay, you need to seek help, and you need to look towards either your agency. And I know there's a lot of fear about going to your agency for this, for a lot of reasons. But at the same time, if that's an obstruction, then privately you just need to seek help and talk to your friends. And most importantly, all of this PPE and all of this stress management, this is a buddy system. You have to look out for your partners, because see something, say something is not just for bombs at the airport, but it's about taking care of each other. Recognizing if I touch my face, that, hey, you touched your face, go wash your hands. Hey, you touched your mask, go wash your hands. Oh, you didn't wash your hands, or whatever, you sneezed, coughed, go wash your hands. Things like that, wipe down your space, etc. That's the PPE part. Making sure you take your PPE on and off right. Also a buddy system thing in the hospital. That's what we try to do as much as possible. If I walk out of the OR, there's a sentinel at the door. I'll give you a perfect example. I was on a barricade last night with the SWAT team, and when I got there, the first thing we did was make sure all of our guys went into masks and put on either an APR or an N95, which we handed out. But the Achilles heel was people walking in and out of the command post in the equipment truck. Why? Because they're all touching the door handles. So the first thing we did was we put a sentinel at every vehicle, so that person was wiping down the door handles after every person went in and out, because that's where you're going to self-inoculate. So a buddy system, and the same thing holds for psychological stress and mindfulness and resiliency. Interestingly, before this happened, Cook County Trauma, in conjunction with the Illinois Tactical Officers Association, runs a conference every year. And this year, the entire theme of the conference, aside from the medical pillars, was resiliency. So giving first responders, giving law enforcement officers specifically tools to learn how to be resilient before the incident occurs is extremely important, because it can reduce and partially mitigate what happens to you after the event happens. And then also providing tools and options and people to talk to for post-incident, to address the impact post-incident, is equally as important. And they're symbiotic. You need both. So, for example, there's an app called Headspace that is free now to healthcare and first responders. It's a great pseudo yoga, chair yoga, just to take a deep breath, mindfulness app. There are options out there.
Do you know of any telemedicine or teledoc that deals with trauma and stress?
There are several options out there. A friend and colleague from who used to be a deputy chief in Atlantic City, New Jersey, is spearheading the Acadia Health initiative on healthcare, on mental health and first responders. That's one option out there. Safe Calls Now is another option out there. There are several that I think everyone should be aware of and should trigger if need be. Most healthcare, even regular doctors and psychologists, are doing virtual telehealth at this point in time, obviously, because we want to minimize contact.
Is this situation far overblown, in your opinion?
I have no idea, and no one does. I think it's cavalier to make a statement like that, because we have enormous numbers of people that are sick all at once, and we are taxing the healthcare system right now beyond what it can sustain in certain parts of the world and country. There are medical advances coming forward. I mean, we have the entire world's medical technology armory focused on one problem right now. That's never happened, to my knowledge. So I hope, and it should accelerate, a solution to this problem. But as soon as this problem's over, there's going to be another one. So the answer to this question, in my mind, is prepare. Be mindful of the degree of misinformation out there. There are drugs. The hydrochloroquine has potential to work. We have no idea whether it works or not. The people that get it may get better just because they were going to get better, or they may get better because the drug had an impact. We're giving it because it's a Hail Mary, but at the same time, I can't tell you from a scientific perspective whether this is really a solution. When you look at the way we grade science, when you read a paper, there's class 1 data, which is double-blinded prospective. It's the best you can have. We have none of that. Class 2 is prospective. Again, intentionally seeking an answer by building a project to answer that question. We have none of that. Class 3 is retrospective data. Again, data. So we're looking at a cohort, looking backwards at it and saying, this is what we had, this is trends. We have a little of that. And that's where a lot of the data really in the world comes from. And then class 4 is, we look back and we say we think, and that's called SWAG, scientific wild ass guess. And then there's class 5, which is WAG, wild ass guess. Most of this is really in the class 4 and 5 data arenas. So keep that in mind, because we don't have answers yet. We're looking back and we're trying to create best practices based on what we know and what places around the world have experienced. But that's not science. That's just experience-based stuff.
Doctor, what crucial lessons have been learned to this point in reference to the pandemic and first responders?
Well, I think we'll learn more of what lessons we need to know as this evolves. But there are a couple low-hanging fruit lessons that for sure we need to take home. One is we need to have a stockpile and surplus of personal protective equipment, and the agencies need to take it seriously. N95 should be fit tested. And the nice thing about fit testing, although it is a pain in the butt for all of us, the nice thing about it is it forces you to actually check your stock, make sure you have it, and make sure our individuals are trained on the use of it. Because just because you have the mask doesn't mean you're using it correctly. So a strategic stockpile of the things that we know work and things that we know don't work is really important. Some of the MacGyver type solutions that have come out of this, both in healthcare and in first response, should be taken to heart. And we should build on those. 3D printing, I think, has been one of the greatest solutions that we've had to solve a lot of problems in the short term, to making clips, to saying, well, these goggles work, they don't work. Shooting glasses aren't good enough. I need better eye protection for my people. I mean, clearly, is a face shield for our state trooper or any street police officer adequate? No, it's a last ditch effort to make sure you have some eye protection, but there are better ways to do it. So more tactically appropriate tools for the environment that offer the same degree of protection. That's one of the lessons I want to go forward with and look at. But more importantly, it's really, I think the biggest, hardest lesson we learned as a country was that we were highly dependent on one source for a whole lot of things in the world, and I hope we change that. And as agencies individually, we got caught with our pants down with regards to a lot of our equipment needed to protect our own people. And priority one for law enforcement leadership needs to be to protect your people. And that's the perspective that we have taken from the leadership in the Illinois State Police, and from I don't know anyone that's not of my friends and colleagues in law enforcement leadership that has not taken that perspective either. I'm sure there are others that haven't, but the lesson is protect your people. And in order to do that, you have to be prepared.
Andrew, do you have a final word of hope for your fellow cops and first responders nationwide, worldwide?
First of all, this will pass. I promise you at some point in time, this will all pass. The greatest ray of hope that I've seen from all of this is that it has really restored my faith in humanity in a whole lot of ways. I've seen people stepping up and providing help and assistance to others where in months past they probably would have walked past them. So it is the empathy and the sympathy and the mere improvement in the way we handle and treat each other has been quite remarkable and should be a restorative degree of hope, I think, for everybody. But for brothers and sisters in law enforcement, my wish for all of you is that you just take care of each other, you support each other, you police each other from a physical perspective, and that you help each other take care of each other's families if people need help.
Thanks so much to Dr. Andrew Dennis and the Illinois State Police for helping make this program a reality and providing such critical information. As for all you first responders, there are not words enough to thank you for being on the front lines of defense. You are gifts from God, each and every one of you. And don't forget us at lineofduty.com for other vital training programs and courses. I'm Ron Barber. Thank you for watching, and remember, next time we may be watching you in the line of duty.